These are in listen-only mode.
Good morning and welcome to the School Health Advisory Council webinar, Partnering for School Health, focusing on social and emotional well-being. I'm Michelle Smith, the State Coordinator for Texas Action for Healthy Kids, and we are excited about today's webinar. We have some great presenters. The School Health Advisory Council webinars are part of our work to support SHACs across the state. We have engaged our partners from Action for Healthy Kids Steering Committee and had lots of support from It's Time Texas, who is hosting a School Health Advisory Council page where you'll find additional resources and links that will be very helpful to you. And so these are the organizations that have been working with us for about the past 18 months to bring schools and school districts more information to help School Health Advisory Councils be more effective. All of you are aware of SHACs, I'm sure, and their main purpose of advising at a district level to help ensure that local community values and parental values are reflected in the district's health education instruction. In Texas, they're mandated by law. They should be appointed by the school board. As I mentioned, they're a voice for parents in the community, and it's a great way to share why health is so important to student success with school administrators and boards. Their responsibility includes reviewing all health-related curriculum and making recommendations on health-related topics. There are so many different areas that impact a school's and a student's health, and trying to coordinate all these into one component is the charge of the School Health Advisory Council. We have worked with a coordinated school health model for many years, and it hopefully takes all of these different aspects of school health and brings them together into what is now known as the whole school, whole community, whole child model. So this is something that was put together in 2014 and is a good place for School Health Advisory Councils to look to focus on the different aspects of school health and still coordinating school health. There are now 10 components: the expanding family engagement and separating it out from community involvement. And then counseling, psychological, social services is the one, and social emotional climate that we're looking at today. So without further ado, I am going to introduce our first presenter. Today we have Starla Simmons, who is with the Austin ISD, and she is, let's see if I can get out of this presentation. Here we go. She is the behavioral health specialist and the campus-based counseling referral centers with Austin ISD, and works with the Austin School Health Advisory Council on the social emotional well-being of our students. So let's see.
Thank you.
You're unmuted. Yes. Okay. Take it away.
All right. Thank you very much. My name is Starla Simmons, and I am behavioral health specialist with Austin ISD, and just very honored to be able to participate in talking about this conversation on school social and emotional well-being. And I'm happy that finally schools have really adopted this coordinated, well, not finally, but that we are adopting this coordinated whole child, every child approach at Austin ISD, where we're really integrating physical health and emotional health and, social safety into children's health. So let me go to the next slide. So I was just going to talk a little bit about how we're set up in our district and what kind of supports that we have with across the district. And they're not every single school, but this is kind of a snapshot of everything that we have to support students' behavioral health, and categorized by the different departments. So under learning support services, we have guidance and counseling. We have social service specialists who are licensed master social workers and licensed professional counselors. There's one for every vertical team, and we're a really large district, really large, probably too large. We have 129 schools. We have a child study system that we use to sort of identify kids who are struggling either emotionally, behaviorally, and a way to channel them into different interventions. We have behavior counselors that work with our long-term ISS, and then we have really great crisis response and suicide response protocol that has really grown and really strengthened over the years. We have social emotional learning throughout the district, and under comprehensive health, which is where I work, I work closely with our school nurses. We have a wonderful program that I'm going to be talking a little bit about, campus-based counseling referral centers, truly a mental health program in the schools. We have family resource centers that connect students and families to the resources that they need. We have started, I've started organizing the AIC Mental Health Alliance, which is really taking all of our mental health professionals in the district and just having a meeting where we come together and talk about the things that we see and make recommendations to the SHAC around social-emotional wellness. And also under comprehensive health services is our wellness coordinator for our staff. And then in special education, we have, all of the services that most special education students receive, but a lot of our kids who have emotional or psychological or psychiatric needs also fall under special ed. So we really utilize our school psychologists, our social behavior skills classes, our special ed counseling team, and care coordination in 504. And then finally, we really rely a lot on our school and community agencies to partner with our schools to provide social emotional services. So we are lucky that we have communities and schools in the majority of our campuses, which provide lots of mental health, social services. We have Safe Alliance, Safe Place that do a lot of groups, the Council on At-Risk Youth. We have social work interns embedded in different campuses through Cap City Kids and also care coordination. So we're a big district, and we're lucky that we do have quite a few things to help students. Right, I'm ready for the next slide. I'm ready for the next slide. So in our district, we're kind of set up in a tiered support. Tier 1 is our guidance and counseling, social-emotional learning, and coordinated health services. That's something that kind of catches all students. Most students can access that. At our Tier 2 is our smaller groups where we have maybe identified kids who have a higher level of need. So that's where CIS, Communities and Schools of Central Texas, the Safe Alliance, the Council on At-Risk Youth, our Family Resource Center, and other community-based agencies that will come into the school and provide either a psychoeducational group or social support counseling or some mentoring. And then our Tier 3 supports are those really high-risk kids where we really activate our crisis response to suicide interventions. Our social service specialists come in at that point and help connect students and families to crisis resources. Our campus-based counseling referral centers are licensed mental health therapists located on campuses, so able to provide clinical assessment, and I'll talk more about that. And we have those at 17 campuses, and then care coordination, which our higher needs families and students have a caseworker who can help them navigate the mental health care system to help them get the services that they need to be successful. All right, I'm ready for the next slide. So our campus-based counseling referral centers is this wonderful collaboration between agencies for mental health. And our partners in this collaboration are Seton Healthcare, Austin Travis County Integral Care, our local Mental Health Authority, and Vita Clinic, a private practice owned by a clinical psychologist here. And so how this works, it's a District 1115 wager project that Seton is managing. They've contracted ATCIC, Austin Travis County Integral Care, to fund and employ therapists, licensed mental health clinicians on campus, an office, a dedicated office, seeing kids. We have 14 clinics there under Austin Travis County Integral Care. We have 3 clinics at Vita Clinic, and they're at the middle and high school level. Vita Clinic was started by Dr. Elizabeth Minnie, who kind of started the first clinic under Seton Healthcare and has since created her own practice and opened up at 2 other high schools and has hired therapists to be employed there. So our Seton, Austin, and Travis County clinics are waiver funded, and we're hoping to be sustainable in the future once, the 1115 waiver monies. We don't know exactly what's going to happen with that, but we're hoping, we don't want these clinics to go away, so hoping that they are sustainable through our billing families insurance as we can. And AISD is really providing the space for these agencies to be on campus and to set up office, and also having a referral team and just working some access to students. So really to support that program. And we have had really great results. It's really increased access to healthcare. And I'll talk a little bit more about that, so we can go to the next slide. So our school-based therapy, the services that are included in this program it's evidence-based individual, group, and family therapy. It's provided by a licensed clinical social worker or a licensed professional counselor or clinical psychologist. The students come in, they have a clinical intake, clinical assessments are filled out, and a diagnosis is given for each student, on a treatment plan is prescribed. So these students and families are really getting that mental health education around diagnoses, around treatment, and best practices right on campus. And the appointments are scheduled during the day, and there's ongoing as deemed medically necessary. And if families don't have health insurance, then they're implementing a sliding scale, but really the whole point is to see kids no matter what in a convenient location to provide that behavioral health care as needed, that maybe they wouldn't have gotten if they weren't right there on school. All right, next slide. So we've seen lots of positive outcomes for our schools. Just the access to professional mental health services has really been one of the biggest things, because we have a lot of social supports in our school system, but not always everybody's over capacity. And so really controlling that capacity and really dedicating that individual time to a really good clinical assessment and treatment plan. I always like to call it treatment, not triage, because schools so often work in triage that we're able to implement a true treatment plan prevention for students in this model. And we've seen decrease in symptoms for kids, so better school functioning, and thus having increased attendance at school. So the campuses are very happy. Also, we've reported lots of just increased communication between the school and the family. So a lot of those kids who are really having a hard time at school and feeling isolated, they're able to have a connected place on campus where they can feel part of the school and feel that the school is helping to take care of them. Same with families. And then also just the experience around having a mental health professional to be able to kind of translate some of these behaviors to the teachers during some of those meetings and really help to support the students and be that be that translator between mental health and education and behavior and achievement, to have that conversation on campus. It really just, the staff is learning about mental health and behavioral health and being able to respond better to students' needs. And then finally, just having a decreased stigma around mental health. You know, it's when we refer kids out, sometimes families may not want to go to see an outside therapist, but when it's someone who's in the school, we can say, oh, go down and see Miss So-and-so, then they're able to make that connection immediately, and it takes down that barrier and really opens them up to receiving the therapy and the help that they need, since it's right there on campus. And so we've seen these great positive outcomes, and we're really excited for this program, and we're hoping to increase and expand and just continue sustaining and supporting students' mental health. And that's all I have. Look forward to any questions you guys have.
Well, good morning. This is Barry Rosenbluth, and I believe I'm on for the next few minutes. Michelle, should I keep going? Okay, well, next slide, please. There we go. Okay. My name is Barry, and I work for an organization which is called the SAFE Alliance. I've been with this organization for 25 years, and all of that time focusing on how we can support children who have been exposed to violence and how we can help schools become more responsive to their needs and reduce their risks for future mental health, physical health problems, and other risk behaviors that go along with the trauma of exposure to violence. So what I'd like to do first is just focus on how important it is for children who've been exposed to violence to get support at school, because as I said, they are at increased risk. And this is an area of mental health that can easily be overlooked, because children who may not be experiencing mental health problems, but if they've been exposed to violence, they're more likely to be in hurtful and abusive relationships with peers and future dating partners, and to begin experiencing other forms of mental health issues later on. And so we've created a program in schools to support these children as they go through their school career. That's what I do, and 2 years ago began to chair the SHAC subcommittee on social, emotional, and behavioral health. Next slide, please. And got together with our committee members, who you see mentioned here, and we said, what can we do? There's so many great things going on in our school district, and there's so many wonderful community service providers, and we're all doing our own parts, but it doesn't seem very coordinated, and we're worried it's not efficient, it's not sustainable. Maybe if our services aren't being well utilized, we won't be able to sustain funding for them. So what can we do as a committee to support the district's efforts? And we decided we would go through a process of identifying problems and coming up with some recommendations. Next slide, please. So this was our purpose, and we wanted to do two things. One, connect vulnerable students to the services available to them. But we also wanted to promote positive social, emotional, mental, behavioral health for all students. So that was our goal. And we felt like to start, we really needed to understand the systems and supports that were already in place. Next slide, please. So this was the method that we took to begin our work. First, we identified what are the initiatives that are going on. Social emotional learning curriculum was just catching on. This was a couple of years ago. There was counseling and guidance. There was beginning of the school-based counseling and referral centers. And then there were all the community providers doing violence prevention and victim services like we were. So we began to identify these initiatives that had as a primary goal to improve students' mental and behavioral health. And so we kind of had to create a boundary because there were so many other programs. So you think teen pregnancy prevention and grief and loss groups and things that, did they fit the definition of being a behavioral mental health service? Once we came up with a list we all agreed on, we began to have meetings and phone interviews with key people within the district and with our community service providers. And we asked them, we used a structured interview to find out what they were doing, how they did it, what were the successes they were having, what were the problems that they were facing, and what do they think would help them achieve their goal. Either making the services more effective, more efficient, reaching greater numbers of students, better coordination. And we took a lot of notes, and then we analyzed all of this data and identified 4 problem areas, and I'll share this with you in just a minute. Once we identified our problem areas and some basic recommendations, we shared these with our key individuals within the district. Our goal was to come up with recommendations that would strengthen their existing efforts and also align those efforts with other local county initiatives for children's mental health. And finally, the recommendations obtained full SHAC approval and were submitted to our Board of Trustees. Next, please. These were the 4 problem areas. We felt that students with mental behavioral health issues, which we defined as violence, trauma, substance use, suicide, self-injury, and other high-risk behaviors, can't learn, and they may be disruptive to the learning environment and also posing a threat to themselves and others. And that while some campuses had very established support systems, others were not so much, and so there was some inconsistency. We also found that there was professional development available, but often it was underutilized. We found that there were mental health services available, but students and families may not be aware of them. There were not maybe sufficient efforts to engage the families, to bring that out into the community, and to reduce the barriers of stigma that prevented students and families from reaching out. And then finally, what we noticed is that there were initiatives going on across multiple departments within the district. There were services coming that were all wonderful, but not as coordinated as they could be to achieve maximum impact. So those were our 4 problem areas we sought to address. Next, please. Okay. Just one second here. I think you've gone one slide too many. Go back one slide. Yes, thank you. Okay. So our 4 recommendations to address these problems were strengthen this existing child studies system, this wonderful model of having a team of adults on each campus who were tasked with staffing students who were struggling with academics, with attendance, with mental health issues, and with relationship issues with peers. And we wanted to be sure that every campus had the benefit of that dedicated team, that team was accountable and meeting regularly and being supported on every campus. We wanted to increase the participation in professional development on mental behavioral health issues. We wanted to make sure that Families and students were getting information about how to access the services, and then ultimately we wanted to make sure that this wonderful 3 tiers of services that Starla just described was sustainable, that the board of trustees understood its value and would commit to sustaining these on each campus. Next, please. So I'll talk now just a little more detail about each one. So for the first one, strengthening this child study system. As I said, we wanted, some schools had a very well established child study teams, and others there were no meetings held. There were it was less responsive, less organized. Not everybody on campus knew how to make a referral, and as a result, some of these services were going underutilized. So we wanted there to be some accountability, and we knew that if we want to hold campuses accountable, we had to offer professional development in building the successful child study team. And I don't know to what extent that's happening, but we all felt it was important that if you're asking principals to support this, that they really understood what their role and maybe could be mentored by a school that had a successful child study team. And just lastly, that the people focusing on children's mental and behavioral health had to also be involved in this crisis response protocol, because so often these issues of personal safety and mental health and student safety all are combined. Next, please. The second recommendation was just make training more accessible, require all campus personnel to receive some training on an annual basis on these issues, so that at least at a bare minimum, everybody could recognize when someone was in trouble and know how to respond effectively and know their responsibility for notifying either a counselor, a nurse, or the law enforcement on the campus, so that we could get that student the help they need. Next, please. The third was making sure that students and families could access these wonderful services easily. So we came up with each of these recommendations has a whole list of tasks and strategies that are too wordy for the slides, but suggestions on how to make these services more accessible, how to encourage a culture of help seeking and positive bystander behavior so that everybody felt like it was okay to support someone in getting the help they need. Next, please. And then to be sure that the district supports the full 3-tiered model on each campuses, meaning all students get some form of social emotional learning curriculum, that the school personnel are using the targeted and intensive interventions so that when they have a student in English who's writing about a troubling experience, that they understand how to make a referral to a targeted or intensive service, and that this be kind of happening on a regular basis, that the services were utilized, and that we felt like we needed a district level behavioral health specialist to coordinate all these various services which span different departments within the district, and that Starla, who you just heard from, is now that person, so we're so happy that she is in that role. Next, please. So my final slide here is really the call to action. After this 2 years of studying the systems and trying to understand what's working and where there are some gaps, these are my takeaways. We need to make it easy for students to get help for themselves and others. Make it easy. Try to eliminate any hoops, barriers. Look at the system from the student's perspective. Whoever they just choose to disclose to or share information with that is concerning should feel prepared and have the capacity to respond in a helpful way. Okay. Don't forget about those Tier 2 services, the small group interventions, the social supports, and skill building groups for vulnerable students. Yes, the critical services are needed, and yes, the universal education is needed. But for those students who are at risk because of exposure to violence or other trauma or other challenges in their lives, these small group interventions can mean the difference between staying in school and coping in healthy ways and and having other serious problems. So all about keep those small group interventions available. They're labor intensive, but I think they have a real prevention effect. I think it's important when we talk about mental and behavioral health to include children exposed to violence and abuse. While they may not be having overt mental health symptoms, they are at increased risk for all kinds of problems, including future victimization and perpetration. And if we're responsive to them at an early age, we can prevent them from a lot of pain and suffering later on. Also, all of our efforts that help promote positive supportive relationships, whether it's No Place for Hate clubs or school-wide campaigns, anything anti-bullying, youth-led projects, are all important for building supportive, inclusive environments, and that is going to decrease mental health issues and increase performance and school climate and school safety for the entire school community. So that brings me to the end. Thank you for listening, and I look forward to questions.
Thanks, Barry. Excuse me. It's really exciting to be part of the Austin SHAC and to see the work that has been done by so many community members and volunteers to help bring together a program that supports students and recognizes not just the students who are at risk and in the most need, but also helps establish ways and channels for students who are not there yet but could be if we don't catch them early. So the early intervention aspects of helping set these programs up and make sure that they're working, that has been developed over the last few years has been phenomenal, and it's exciting to see the success that we're having. Although we are a large district and all districts may not be able to implement things at the level we have, hopefully some of the things that you're hearing, if you're in a smaller district, will trigger ways for you to look at your school and look at your mental health issues and see how you can approach it from a similar perspective. We will, by the way, we are recording this session and we will have this available, and we will, post that and send out the information to everybody so that if you have others that you feel could benefit from watching this webinar, you'll have that opportunity. So our third presenter is Karen Brown. She is with the Texas AHEC East in Waco, and she will give you a little bit different perspective on a resource that can be used in a smaller setting and can be available. So Karen, I think you're unmuted. I'm going to turn this over to you.
Thank you. Thanks for having me on today. Yeah, so Texas AHEC East, AHEC stands for Area Health Education Center. We have a very broad mission statement of making our communities healthier, and mental health first aid is one component of how we address that mission statement. If you go to the next slide. Thank you. So mental health first aid, it's kind of what it is. It's the help offered to a person developing a mental health problem or experiencing mental health crisis. It's like CPR, so help is given to, until appropriate treatment and support are received or until the crisis resolves itself. It's not a substitute for counseling or medical care or other professional treatment. It's more, this is for anybody and everybody to have a better understanding of mental health and what to look for. Go to the next slide. Mental health first aid is managed. This is a national program that's managed nationally through the National Council for Behavioral Health, as well as Maryland and Missouri government. So this is a set training 8-hour course. It originated in Australia. They have varying options. So there is an adult mental health first aid, and then I'm going to talk about youth mental health first aid. And by youth mental health first aid, we're talking about adults who work with youth ages 13 to 18, or we can also train students themselves if they're 16 or older, and they're kind of in a peer leadership role. I know some groups and schools have like peer mentors or something, and if they're in a leadership role with their peers, we can train them as well. But this is, again, for adults who work with youth, but there are varying options of trainings out there that mental health first aid offers. The next slide. So participants will learn how to recognize warning signs, factors and warning signs of mental health concerns, particularly in youth. They've shown that mental health disorders exhibit themselves differently in youth than adults. That's why there are two different trainings, because there is a difference in how they show and what to look for. You'll learn information on the depression, anxiety, and trauma, and there's a 5-step action plan to help someone that I'll talk about in just a minute. You can go to the next slide. So this is the action plan that we teach in these courses. So algae is our mnemonic device, and you see our little koala bear up there. So we come in and we have a little koala mascot that we've named Algae to help people remember. So algae stands for assess for risk of suicide or harm, listen non-judgmentally, give reassurance information, encourage appropriate professional help, and encourage self-help and other support strategies. And that's the action plan that we teach, and we go through each step and how it can be implemented in both crisis and non-crisis situations. Next slide. Oh, forgot that it says all this fancy stuff. Okay, so this is a slide that we talk about, so where mental health first aid comes in help. So you can see this chart or this diagram might look a little confusing. So you can see at the bottom where it says people are well, and then early intervention of when somebody is becoming unwell. So mental health first aiders, and when you take this course, you're certified for 3 years, it's a 3-year certification, are able to identify when somebody is beginning to go from well to unwell. So it helps, you can identify when somebody we have warning signs of there might be a mental health crisis going on, and then through early intervention, and then it overlaps a little bit with when they're unwell in treatment, because mental health first aiders can help provide encouragement and support for students and youth when they're beginning treatment, and to keep being that support for them as well. Next slide. So why mental health first aid? Mental health problems are common adults and youth. People don't think about our youth having them sometimes, but it's estimated about 20% of our youth ages 13 to 18 have a mental health disorder. Sometimes it's long-term, sometimes just episodic. So it's very common, and there's a lot of stigma with associated mental health problems. So mental health first aid helps, if nothing else, create understanding and address the stigma. Just because you're trained in this course does not mean you're obligated to provide help, but it does help your understanding and help sometimes with the patients, with your students, understand what they're going through, and create a little more empathy. Professional help is not always on hand. As our presenters, they did a fantastic job showing their services, but they acknowledge sometimes, even though you have all these services and options, the high volume that the providers are seeing, when you have one professional to 400 students, people fall through the gaps. And so if all the lay people, all the adults are trained in what to look for, it just increases eyes and ears around to help our students, to make sure that our students aren't falling through the gaps. Individuals with mental health problems often don't seek help, especially youth. I mean, that's true for adults too, but especially youth, because sometimes they don't know that they have a problem. They're not recognizing it in themselves first. That's one of the many reasons. And then in general, a lot of people aren't informed about mental health problems, and then they don't know how to respond. Sometimes the general public, when you talk about mental health problems, they get uncomfortable and they don't know what to do. Even if they wanted to help, they don't know, they're uncomfortable about how to approach somebody or what to say or what to do. They're afraid they're going to do something wrong. So this course just kind of helps people become more comfortable with addressing mental health and talking about mental health and creating that, again, that empathy. Next slide. This slide, as you can see, is last year's slide, so these numbers are a little off. There's definitely a lot more numbers. This is a whole year behind with our training, but it just shows how many people are trained across our country. So it is a national program that is being implemented across states all over. Next slide. And then this, in general, I do believe this is probably more for our, this is the adult training that shows that, again, appropriate for anyone 16 years or older who works with youth or even the personal life. I know doesn't necessarily have to be schools, all these civic clubs, most people, a lot of people we've had that come to our trainings will come with their organization and work, but once they get the training, they're thinking about their own child or their child's friends or their nieces. They're starting to see something in their personal setting as well. A lot of adults are, involved with extracurricular activities with youth as well. So we have a variety of backgrounds that come. Anybody is good for anybody. The more people have this training, it helps just increase eyes and ears no matter where you are. You don't know where you're going to come across somebody who might need help, whether it's your work, home, or just personal life and out and about. Next slide. This is an evidence-based course. You can click again. It's going to be one of those that comes up. Clicking. Here you go. So it is an evidence-based course. It's recognized from SAMHSA's National Registry of Evidence-Based Programs. Brief background, again, it was developed in Australia in 2001, and it's been adapted and managed by the, National Council of Behavioral Health, Maryland Department of Mental Hygiene, and Missouri Department of Mental Health. So it increases knowledge and understanding, encourages people helping people, it supports people getting help, decreases social distance, and increases mental wellness. Next slide. These are just a few articles that have been done about mental health first aid. If you Google mental health first aid or use mental health first aid, you're going to find some articles. These are some ones that we like to highlight. Your interest. Next slide. And then again, a couple of news quotes of NYU also added mental health first aid training course. Employees who work in campus hotspots learn to identify mental illness symptoms as well as how to diffuse a tense situation until help arrives. A hotspot is any place prone to frustration, including the financial aid office, bursar's office, and the registrar's office. And again, you can apply this to your SHAC in your school, own school setting of where would be a hotspot. I love that term, hotspot. Attend a traditional first aid class and you'll learn checklists for assessing and responding to cuts, burns, and strokes. The mental health first aid students consider how they respond to a stranger having a panic attack, a friend expressing hopelessness, or a client distressed over an illness. We do, it's an 8-hour course that can be broken down into 2 sessions if need be. We can do, 2 4-hour classes and trainings. It's very set in that curriculum, but it is very interactive and involved. We do realistic scenarios. We do crisis, non-crisis. It's a lot of participant interaction and engagement. We're up and moving. It's not just sitting and being lectured to the whole time. It is a very interactive, engaging course that we hope that everybody, when they leave, we've always had very positive comments about how great the course and how much more they learned and the empathy that they were attained. Next slide. So, you can find, again, we offer youth mental health first aid. Again, adults working with youth is what we're certified for. And that's, again, with our SHACs that we're promoting. If you're interested for adult mental health first aid or Spanish, you can go to that website to find more information. You can contact me, and if you have any questions, I'll be happy to answer them as well.
Thanks, Karen. So I hope that you got a good overview of some things that different school health advisory councils are doing, and then what some of the resources are. I mean, how you want to approach mental health and social emotional well-being in your school district from your SHAC could be from the perspective of setting up procedures and protocols for dealing with anything from tragedies to trying to set up and establish safety nets, or to helping work towards preventing mental health issues. It's going to be what your community and what your school district needs. But we hope that what we've given you this morning gives you a little bit better idea of some of the things that you can look at and some approaches that you could take. If there are any questions out there, we have these three great presenters that would be happy to answer them. While you're thinking about that, I'm going to unmute Sarah Jefferson and let her talk about a couple of things that are available through It's Time Texas for webinar participants. Sarah, are you there? You have to unmute yourself. There you go.
Here we go. It's Time Texas will be sending webinar certificates for all attendees by next Tuesday. If for some reason you do not receive a certificate, please contact us at webinar@itstimetexas.org, or feel free to contact Michelle Smith, the facilitator. We will also, in the email with your certificate, will be a link to a survey, just a couple of questions to provide feedback on the webinar and how we can continue to help support your SHAC efforts. And then if you're looking for additional resources or webinars that the SHAC leadership group has done, check out itstimeresources.org/webinar, and you'll see a variety of other webinars there in addition to the ones that we're doing today. And then for more SHAC resources, as Michelle mentioned previously, there are some resources, the newly updated SHAC guide that DSHS has done and put out. Check out their website, but other resources that TALK has at itstimetexas.org/SHAC. Thank you so much.
Thanks, Sarah. So I'm not seeing any questions. I know this is a tough topic, and it's one that a lot of school health advisory councils kind of skip over, but it is part of the whole child coordinated school health model and is an important part of what we need to be looking at to keep our kids healthy and ready to learn. So I hope that you will seriously consider working on this component. And if you have questions in the future, you can go to the It's Time Texas website and enter questions, and we will get back with you with answers, or you can email me at msmith@actionforhealthykids.org. Thank you, Barry. Thank you, Karen. And thank you, Starla, for giving us your time and your expertise on this very important topic. And we hope that you will join us on future webinars around school health advisory councils. And I guess if there are no questions, I'm not seeing any, that we will give you back a few minutes, and y'all have a great rest of the week. Gotta make sure I don't, if I'm not careful, I will